Hello, thank you for joining me today. I am Dr. Ricardo Kotliroff. In this video, we will talk about what progressive supranuclear palsy is all about, the signs and symptoms, possible complications, treatment, causes, diagnosis of progressive supranuclear palsy, and much more. What does progressive supranuclear palsy mean? First, we must understand what progressive supranuclear palsy is all about. Progressive supranuclear palsy, also known as Steele-Richardson-Olszewski syndrome, is a rare brain illness believed to be the cause of serious problems with walking, balance, and movement of the eyes. This illness is a result of degeneration of the cells in areas of your brain that control body movement and thinking. Let me explain what this disorder does. As the long name of this disorder shows, the disease deteriorates, progressive, and also causes weakness, palsy, by harming certain parts of the brain above nerve cell clusters, which are known as nuclei, supranuclear. These nuclei control the movement of the eyes. You should also know that one of the typical symptoms of this disease is the inability to control the eyes properly, which individuals may experience as blurring of vision. The main brain areas affected are the brainstem, the basal ganglia, the cerebral cortex, the dentate nucleus of the cerebellum, the spinal cord, the brainstem, particularly the part of the midbrain where the supranuclear eye movement resides, the basal ganglia, particularly the substantia nigra, the subthalamic nucleus, and the pale globe. They are responsible for the performance of executive functions, learning, motor control, emotions, and behavior. The cerebral cortex, particularly that of the frontal lobes, it is a control center for different aspects of our ability to communicate and our personality. Many of our cognitive skills depend on their functioning, such as spontaneity, memory, language, judgment, control of impulses, comprehension and problem solving, emotional expression, sexual and social behavior, as well as motor functions. The dentate nucleus of the cerebellum. It is the largest single structure that connects the cerebellum to the rest of the brain. It is responsible for the planning, initiation, and control of voluntary movements. The spinal cord, particularly the area where part of the bladder and bowel control resides. What are the symptoms? To further expand your knowledge on progressive supranuclear palsy, progressive supranuclear palsy is an uncommon degenerative CNS illness. In every 100,000 people in the world, only 3 to 6 people have progressive supranuclear palsy that progressively causes damage to voluntary eye movements, and it usually begins in late middle age, and causes include sudden loss of balance. Another symptom of progressive supranuclear palsy is sudden loss of balance. While walking, falling backward may occur very early in the disease. An inability to aim your eyes properly. You may find it hard to look downward, or you may experience unclear, dim, and double vision. This problem with focusing the eyes can make someone look uninterested in conversation due to poor eye contact. Another thing you may experience is difficulty looking up or down without moving the neck, or problems with climbing up and down stairs. Voluntary vertical movement of the eyes is difficult, but reflexive eye movements are not affected. Signs of progressive supranuclear palsy differ and may imitate that of Parkinson. These signs deteriorate as the disease progresses. Stiffness and awkward movements. Bradykinesia is a sluggishness or slowness of movement. Bradykinesia is sometimes linked to an impaired ability to adjust the position of the body. Muscles become tough. Muscular stiffness is one of the most common causes of muscle pain you may experience. It's characterized by the inability of the muscles to relax without force. This condition can affect the muscles in the body, causing sharp pain that makes it difficult to move. Axial dystonia develops. Progressive axial dystonia is an illness of movement in which a person's muscles contract involuntarily. This contraction causes the affected body part to twist uncontrollably, resulting in repetition of movements or abnormal postures. Dystonia can affect one muscle or the entire body. Problems with speech and swallowing. Dysphagia is difficulty or discomfort in swallowing. Dysarthria is difficult articulation of speech that is otherwise linguistically normal, with emotional lability. Both dysphagia and dysarthria are common. Pseudobulbar palsy, PP, also known as uncontrollable emotional expression disorder, is a condition that affects your ability to control the muscles in your face, not excluding your jaw. The muscles in your tongue and throat are also included. A spastic weakness of the lower cranial nerve muscles, cranial nerves 5, 7, and 9 through 11, may be noticed on examination, with accompanying dysarthria. This can mean a lot to your everyday life. It can also affect your ability to speak, eat, and swallow. In addition to these symptoms, you may likely experience involuntary crying or laughter and pathological grimacing at odd times, at times following little or no stimulation at all. This is known as emotional incontinence. You may also develop resting tumors, aversion to bright light or fear of light, or photophobia, a painful sensitiveness to strong light. Sleep disturbances, loss of interest in fun activities, difficulties with memory, reasoning, problem-solving, and decision-making. Dementia eventually occurs. This is a disorder that affects the brain and memory and makes one gradually lose the ability to think, reason, and behave normally. You are also likely to experience depression and anxiety and a surprised or frightened facial expression resulting from tough facial muscles. What are the possible complications? Now that you know what progressive supranuclear palsy is and the symptoms, the next thing to know is the possible complications. The basic complications of progressive supranuclear palsy come from the inability to control muscle movements. These complications include falling, which could lead to head injuries, fractures, and other injuries. Problems focusing your eyes, which can also lead to injuries. Sleeplessness. Problems looking at bright light. Aspiration pneumonia. Aspiration pneumonia is caused by the inability to control the muscles of the throat. This inability can lead to severe swallowing difficulties, which can also lead to choking or inhaling food or liquid into your airway. Aspiration can develop into pneumonia, which is the leading cause of death in people with progressive supranuclear palsy. To avoid the dangers of choking, a feeding tube may be recommended. Another thing you should take note of is impulsive behaviors. For instance, standing up without help, which can lead to falls. To avoid injuries due to falling, a walker or a wheelchair may be appropriate. What causes progressive supranuclear palsy? You may be treating the wrong thing if you do not know the causes of this disorder. Genetic causes. You see, the gen is a unit of DNA usually found on a chromosome and that dominates the development of one or more traits and is the primary unit by which genetic information is passed from parent to offspring. This MAPT gene, or microtubular associated protein tau gene, found on chromosome 17, provides instructions for making a protein called tau. This protein is also found throughout the nervous system, including nerve cells in the brain. Tau proteins are the proteins that control or stabilize microtubules in the cell. This protein tau is linked with microtubules, the structures that support a nerve cell's long processes that transmit information to other nerve cells. It is involved in assembling and stabilizing microtubules, which are tough, hollow fibers that make up the cell's structural framework, the cytoskeleton. Microtubules help cells maintain their shape, help in the process of cell division, and are important for the transport of materials within cells and to transmit information to other nerve cells. Let me explain protein isoform. A protein isoform, or protein variant, belongs to a group of highly similar proteins that carry out the same or similar biological roles. 6 different versions, or isoforms, of the tau protein are produced in the adult brain. The isoform's length range from 352 to 441 protein building blocks, called amino acids. The part of the protein known as the microtubule binding domain, MBD, links to microtubules, which differ among the isoforms. Among 3 of the isoforms, the microtubule binding domain, MBD, has 3 repeated sections. Among the other 3 isoforms are 4 repeated sections. The brain contains almost the same quantity of 3 repeat isoforms and 4 repeat isoforms. This balance is paramount for the function of normal neurons. You need to understand that progressive supranuclear palsy happens irregularly and the cause is still unknown. But on rare occasions, the disease results from a change in the MAPT gene, which gives faulty instructions for making tau to the nerve cell. There is a central theory in many neurodegenerative diseases that once the unusual aggregates of proteins like tau form in a cell, they can affect a linked cell to also form the protein clumps. In this vein, the toxic protein aggregates spread throughout the nervous system. The cause of this process remains a mystery. The hallmark of this disease is the accumulation of abnormal deposits of the protein tau in nerve cells in the brain, an abnormally phosphorylated tau protein, so the cells do not work properly and die. But genetic factors have not been implicated in most individuals. The accumulation of tau puts progressive supranuclear palsy in a group of disorders called the tauopathies, which also includes other disorders such as Alzheimer's disease, corticobasal degeneration, and some forms of frontotemporal degeneration. Scientists are looking at ways to prevent the danger of an abnormal tau protein in treating each of these disorders. Other theories about the causes of progressive supranuclear palsy. There have been other theories about the causes of progressive supranuclear palsy, and these theories include: an unconventional infectious agent takes years or decades to start producing visible effects, as seen in other disorders like Creutzfeldt-Jakob disease, a rare progressive fatal encephalopathy caused by a prion, an abnormal form of a normally harmless protein found in the brain that is responsible for a variety of fatal neurodegenerative diseases and marked by development of porous brain tissue, premature dementia in middle age, and gradual loss of muscular coordination. Another possibility is that random genetic alteration that occurs in all of us all the time also occurs in particular cells or certain genes in just the right combination to hurt these cells. And the third possibility is that exposure to some unknown substance, a chemical in the food, air, or water, can slowly damage some certain vulnerable areas of the brain. This theory comes from a clue found in the Pacific island of Guam, where a common neurological disease occurring only there and on a few neighboring islands shares some of the characteristics of progressive supranuclear palsy, Alzheimer's disease, Parkinson's disease, and amyotrophic lateral sclerosis. Its cause is believed to be a dietary factor or toxic substance found only in that area. Another possible cause of progressive supranuclear palsy is cellular damage caused by free radicals, which are reactive molecules produced continuously by all cells during normal process, which food is changed into energy in the body. Although the body has natural mechanisms for clearing free radicals from the system, scientists suspect that under certain circumstances, free radicals can react and damage other molecules. Great research has been directed to understand the role of free radical damage in human diseases. The diagnosis of progressive supranuclear palsy is clinical. Magnetic resonance imaging, MRI, is usually done to outrule other illness. In advanced cases, magnetic resonance imaging shows a characteristic reduction in midbrain size that is best seen on mid-sagittal views and that make the midbrain to be shaped like a hummingbird or emperor penguin. The only proven risk for PPS is age. The condition typically affects people around the age of 60, and it does not affect people under the age of 40. Differential diagnosis of progressive supranuclear palsy and Parkinson's disease and other diseases. Both progressive supranuclear palsy and the disease of Parkinson cause rigidity, difficulty in movement, and clumsiness. But progressive supranuclear palsy is more rapidly progressive as compared to that of Parkinson. People with progressive supranuclear palsy usually stand straight at times and even tilt their heads backward, though they tend to fall backward. This is known as axial rigidity. Those with Parkinson's disease normally bend forward. Speech and swallowing difficulties are much more common and severe in progressive supranuclear palsy than in Parkinson's disease, and it shows up earlier in the course of the disease. Eye movements are not normal in progressive supranuclear palsy, but close to normal in Parkinson's disease. There are similarities between progressive supranuclear palsy and Parkinson's disease you should take note of, including beginning in late middle age, slow movement, and rigidity of muscles. Tremors are common in individuals with Parkinson, but is rare in progressive supranuclear palsy. Although people with Parkinson's disease benefit from the drug levodopa, people with progressive supranuclear palsy respond minimally and only briefly to this drug. Also, people with progressive supranuclear palsy show buildup of the abnormal protein tau in affected brain cells, while people with Parkinson's disease show buildup of a different protein known as alpha-synuclein. Differential diagnosis of progressive supranuclear palsy and strokes. Many lacunar strokes in the basal ganglia and deep white matter can look like progressive supranuclear palsy. However, this disorder is non-degenerative and grows more gradually. Treatment. Presently, there is no effective treatment for progressive supranuclear palsy, but some symptoms can be treated with medication or other interventions, although scientists are searching for better ways to treat the disease. In some patients, the slowness, rigidity, and balance problems of progressive supranuclear palsy may respond to anti-Parkinsonian agents, such as levodopa or levodopa combined with anticholinergic agents, but the effect is not permanent. The speech, vision, and swallowing problems usually do not respond to any drug treatment. In addition, another set of drugs that has been of some modest success in progressive supranuclear palsy are antidepressant medications. Example of these most used drugs by people are Prozac, Elavil, and Tofranil. The anti-progressive supranuclear palsy advantage of these medicines seems to not be related to their ability to dispel depression. Non-drug treatment for progressive supranuclear palsy may take a lot of forms. Patients regularly make use of weighted walking aids because of their probability to fall backward. Bifocals or special glasses called prisms are sometimes recommended for progressive supranuclear palsy patients to proffer the solution to the problem of looking down. Formal physical therapy is of no use in progressive supranuclear palsy, but certain exercises can be done to keep the joints limber. Gastrostomy is a surgical procedure that may be necessary when there are swallowing disturbances. This surgical procedure involves the placement of a tube through the skin of the abdomen into the stomach for feeding purposes. What is the prognosis? To conclude, in the complications I have described above, the most common ones are choking and pneumonia, head injury, and fractures caused by falls. With good attention to medical and nutritional needs, it is possible for individuals with progressive supranuclear palsy to live a decade or more after the first symptoms of the disease. The most common cause of death is pneumonia. Thank you for your time. If the knowledge provided in these videos enriched and formed the basis for the recovery of your joy, well-being, and quality of life, we have reached our humble goal: to help as many human beings in the fight against disease and in the recovery of health and life expectancy. This is the light and the force that guides us. Whoever saves a life saves the whole world. I present Miranda, part of our team, who will explain our treatment program for progressive supranuclear palsy. See you soon, and thank you very much.
Thank you, Dr. Ricardo Kotliroff, for your excellent explanations of this terrible disease that affects millions of people all over the world. When we began, Dr. Kotliroff was able to treat persons with diseases by using acupuncture, which had amazing results. However, there was a problem. Only those who lived close to the clinic at the time were able to be part of these fantastic treatments. Patients from all over began to hear of Dr. Kotliroff's success and wanted to experience these results themselves. They asked that more clinics be opened in other locations, but this unfortunately wasn't possible. So to solve this problem, Dr. Kotliroff began to develop homeopathy-based remedies that were based on acupuncture's principles and went on to make these treatments available worldwide. Since then, Premilife's remedies can help patients in any part of the world. These remedies can be ordered online and are then delivered right to the patient's home. Our treatment method allows us to prepare our remedy based on the diagnosis that we receive, which means that once you have been professionally diagnosed, you can then order our treatment based on the illness that you are diagnosed with. Now, I'd like to invite you personally to be part of Premilife's success and join all the thousands of patients worldwide who are already finding great improvement in their condition using our remedies. Our reason for doing this is very simple. When we cure someone and we see their relief and joy when they realize that their symptoms have been ended or slowed, we feel good inside. We feel proud, satisfied, and happy for them. Genuinely happy. You may know this saying, the two most important days in your life are the day you were born and the day you find out why. Every person has a purpose in life, whether it's teaching, leading, or empowering. I believe that our purpose here at Premilife is to help people get over their illnesses, letting them lead healthy, long, and comfortable lives. Premilife wants to be your partner in managing your diseases. Since our founding in 1980, Premilife has dedicated decades to helping patients throughout the world experience gradual improvement of diseases via homeopathy. Our homeopathic treatments are manufactured under strict quality guidelines for healthcare from the World Health Organizations. Premilife's unique homeopathic treatment is specifically designed and formulated to assist you in managing your disease. The different ingredients in each pill increase your likelihood of success. You can take our homeopathic medicine with any conventional medicine that you might be using. By ordering through Premilife, you get consistently high-quality homeopathic treatments based on the latest advancements in our field, natural remedies, unique and proprietary formulas, and direct hands-on experience treating patients the world over since 1980. Now that you understand what our treatments are and what they can do for you, I want to answer a common question. Is there any recommended time period for treatment? We strongly recommend that patients commit to a program of at least 6 months, although longer programs, 12 to 24 months, may even offer greater effectiveness. The duration patients participate in our program often will depend on the severity of the patient's illness and the improvements that are realized. Premilife continually monitors each patient's progress and will optimize his or her treatment protocol as needed. If you are interested, I would like to ask you to click the button located under this video and join thousands of satisfied customers who are grateful each day for choosing the Premilife treatment and have embarked on a new life. I will be very happy if you give us a chance to help you too. It's time to do something for yourself so you can do more and be more for the people and family you love. You deserve this, and so do they. Let's get started right now. Don't let this become a secondary priority. Just click the Get Started button and you'll be on your way to enjoying a happier and healthier life. Click that button now and order the homeopathic treatment. If this video has enlightened you, don't forget to share it with your friends. I want to thank you, viewers, for taking your time to watch this video. I hope you enjoyed it.